Hello, I'm Dr. Sindhu, one of treating doctor here today. May I confirm your good name, please? Nice to meet you, Mr. Sajad. May I know what brings you here today? Okay. Tell me more. I'm very sorry to hear about that, Mr. Sajad, and I understand your worries. But before I come to the management part, I'll need to ask you a few questions. How it sounds to you, Mr. Sajad? Thanks for your cooperation, Mr. Sajad. So, is there anything else you want to add? Okay, Mr. Sajad, is there any loin pain along with that? Okay. If it radiates anywhere else? Okay. If it is bilateral or unilateral? Okay. If there is any associated fever with chills, have recorded fever. Okay. All right. If fever is continuous or it comes and goes. Okay. Any particular time? Okay. Do you have fatigue and malaise along with that? Nausea, vomiting? All right, Mr. Sajad, if you're having urinary frequency, have you noticed burning while passing urine? Okay. Do you notice discomfort or pressure in your lower abdomen or in pelvic area? Urinary incontinence? Okay. Have you noticed any strong unpleasant odor of urine? Wake up at night to urinate? Okay, Mr. Sajad, have you noticed any change in flow and stream? Okay. Do you fully empty your bladder while urinating? All right, Mr. Sajad, if you had UTI in past, okay. All right, Mr. Sajad. So, are you dehydrated? How much water do you take per day? Okay. If you had any catheterization recently, you use scented soaps. Okay. Right, Ms. Sajad, may I know your age? All right. And do you urge to urinate? Okay. Have you noticed any discharge or pain while passing urine? All right, Mr. Sajad, I'll ask few personal questions to better understand. Is it okay with you? Thanks for your cooperation, Mr. Sajad. So, do you smoke? How much cigarettes per day? Have you ever tried this habit? I appreciate it, Mr. Sajad, and we'll talk in detail in next appointment. How it sounds to you? All right, Mr. Sajad, do you drink alcohol? Okay, and do you have high blood pressure, high blood sugar, any kidney-related problem? Any immediate family member suffering from a renal problem, high blood sugar, suffering from same symptoms? All right, Mr. Sajad, do you have any habit of delayed passing urine due to long journey? If you are married, okay. Do you have children? Okay. All right, Mr. Sajad. So, in order to reach my diagnosis, I need to order a few investigation. How it sounds to you, Mr. Sajad? Yes, Mr. Sajad. But before I offer, let me confirm it from you that have you undergone any investigation so far? All right, Mr. Sajad. So I'm offering you midstream urine, okay, before starting antibiotic, okay, and urine should reach laboratory fresh, okay. And do you know what is midstream urine? All right, Mr. Sajad, you need not to be worried. I'm here to explain it to you. Actually, you have to collect urine sample during the middle of urination, okay? You have to avoid initial and final flows, if it makes sense to you. Yes, Mr. Sajad, 10 to 20 ml is enough, okay? And along with that, I'm offering you EGFR, okay, and complete blood count, okay, and ultrasound, kidney, urine, ureter, and bladder, okay, and then I'll decide, okay. Okay, you're undergone. Okay, so may I know the results of investigation, Mr. Sajad? If you've already gone through any of these tests? Sajad, 25 years. Okay, Mr. Sajad, so the information you have shared with me, and according to the investigation done already, you have shown me, okay, you are probably having a condition what we call in our medical terminology as urinary tract infection, okay, and so this is a common condition, okay, but it is curable, okay, you need not to be worried, okay, and the positive organism in 70% of cases is simple bug called E. coli, okay. And so, Mr. Sajad, I'll advise you to follow some lifestyle changes, okay, and certain medicines. How it sounds to you, Mr. Sajad? Yes, Mr. Sajad. So I'll offer you to increase fluid intake up to 3 liters per day, okay? And I'll advise you to urinate frequently, okay? Do not let urine build in bladder, okay? And I'll encourage you to wide double, okay? Go to toilet after 5 to 10 minutes again, okay? And wide after intercourse, okay? And do not use nylon undergarments, okay? And wear cotton garments, okay? And stress, reduce stress, okay? And keep maintain good hygiene, okay? Use loose, okay, cotton cloths, okay? And along with that, I'm offering you tablet paracetamol for pain, okay, while passing, as you stated, your pain, passing urine, okay. So tablet paracetamol 500 mg, you have to take it twice a day, okay. And I'm offering you tablet nitrofurantoin, okay, 100 mg. You have to take it twice a day, okay, for 3 days. How it sounds to you, Mr. Sajad? Okay. Yes, Mr. Sajad. So, if you notice any worsening of condition, okay, fever did not subside despite treatment, okay, and then you can contact me anytime, okay, and when your ultrasound report is ready, okay. All right, Mr. Zafar, Mr. Sajad, if there is any thing you want to discuss with me today. All right. So, Mr. Sajad, here is a leaflet. It includes all the information regarding your condition. I hope it will be helpful for you. Okay. So, I wish you speedy recovery, okay, and healthy life. And I'll see you after 1 week, okay, if it is convenient for you. All right, Mr. Sajad. Bye-bye.